Hello, and welcome to eMedicore Patient and Nurses Corner series. Today's discussion is on urinary catheters. Catheters are essentially hollow tubes that are commonly made of latex or silicone. Urethral catheters are inserted through the urethra into the urinary bladder. Two general categories of urethral catheters are straight or Robinson catheter and indwelling or Foley catheter. Catheters are sized by the diameter of the lumen on a French FR scale of numbers. The larger the number, the bigger the lumen. Small sizes, such as 8 or 10 French, are typically used in children. Larger sized catheters, such as the 14, 16, or 18 French catheters, are commonly used in adult patients. 22 or 24 French catheters are usually used in patients with gross hematuria or used for bladder irrigation. This is an image of a Foley catheter. Notice the balloon port and the inflated balloon. Straight-tipped or Robinson catheters are a type of catheter in which there is a single lumen with two eyes or openings near the tip of the catheter. This type of catheter is used for a straight cath, or in and out catheterization of the urinary bladder. It is inserted into the bladder to drain the urine and then removed. A coude catheter is a type of catheter that is very useful for men with enlarged prostates. Its curved tip will allow the catheter to pass through the enlarged prostate smoothly. The coude catheter may cause less trauma in men with enlarged prostates than a straight-tipped catheter. In many cases, after failed catheterization of male patients with a straight-tipped catheter, success was achieved when using a coude catheter. When using the coude catheter, make sure to keep the curved tip pointing upwards towards the ceiling. One trick in knowing which way the curved tip is pointing is to look at the balloon inflation port or the mark at the end of the catheter. The direction of the balloon inflation port is approximately in the same direction the curved tip is pointing. An indwelling or Foley catheter is a type of catheter that has an inflatable balloon near the insertion tip. The balloon is inflated with water after insertion into the bladder. This anchors the catheter inside the bladder. It is usually pre-connected or connected after the insertion of the Foley catheter to a closed drainage system. The diameter of the catheter and the size of the balloon are usually indicated on the valve of the balloon inflation port, such as 16 French 10 milliliters. The size of the balloon may range from 5 milliliters to 10 milliliters for regular Foley catheters and 30 milliliters in large irrigating catheters. There are generally two types of Foley catheters, the two-way Foley catheter and the three-way Foley catheter. The three-way Foley catheter is similar to the regular two-way Foley catheter, except that it has a third channel through which a sterile fluid can be irrigated into the bladder. From the bladder, urine and fluid can drain out through the larger second channel into the urine drainage bag. Notice in the image for the three-way Foley catheter that the drainage port is larger and in the middle. eMedicore, core medical education for everyone.
From everyone.